Hello everyone, this is Dr. Piyush Kumar Agrawal, your cancer surgeon. Today I will talk about feeding jejunostomy or gastrostomy. When a patient is unable to take feed orally or we cannot keep rice tube for prolonged period, then we put a tube in the stomach or small intestine. When we put it in the stomach, it is called gastrostomy. When we put the tube in a jejunum, that is small intestine, we call it feeding jejunostomy. So gastrostomy can be done endoscopically or by open procedure. If a scope can be passed into the stomach, then it can be done endoscopically. We prefer to do it endoscopically if a scope can be passed. Feeding jejunostomy can be done laparoscopically or by an open procedure. So why do we do it? So when we do a surgery in which there is involvement of proximal digestive tract like esophagus, stomach, duodenum, pancreas, and we want to start early feeding, then we put feeding jejunostomy. When there is an obstruction to upper aerodigestive tract, which we cannot do anything about, and we don't expect an early recovery from that, we put feeding jejunostomy so that the nutrition of the patient can be maintained. In patients where we expect a complicated recovery also, there also we put for feeding to commence early. And in few neurological conditions and chronic conditions where we expect patient not to take orally, there also feeding jejunostomy is a better option. It's relatively easier to maintain. So there are few complications that can happen with feeding jejunostomy, small ones, but like there can be accidental removal, which is one of the most common thing, but it can be put again. Then there can be diarrhea because the food directly goes into the small intestine. There can be metabolic derangements, there can be infection, there can be bleeding, there can be granulation around the part where tube comes out of the skin, which can cause bleeding also. Then there can be peritubal leakage, but these are small minor complications and your doctor will help you to overcome them. Thank you.